there's a lot going on in our world. There is a lot going on. I mean, a heated argument about Afghanistan, the Taliban, and our hearts go out to the citizens of Afghanistan. It's a very tough time. I can imagine their health and mental state at this point, but we hope that issues in that space will be resolved as soon as possible. While that is going on, we are here making sure that your health is our focus, your health is our priority. This is the Health Corner on the Morning Rave on Rave TV. My name is Dr. George. It's a beautiful day to talk about your health, and today we'll be talking about something very, very important. It's a common topic. We'll be talking about ulcers. I know some of you have seen it, and I'm glad that you've joined us. We're talking about ulcers. It's called peptic ulcer disease, but I didn't want to get you confused. I just left it as stomach ulcers, but it's actually peptic ulcer disease. We'll be addressing that amongst other things. My guest is already in the studio with me. I'll be giving you the health news before we go into that, and there's a lot happening in the health space. First of which, that preterm birth may increase the chance of autism. Preterm birth may increase the chance of autism. Babies born preterm or early term may have as much as 4 times higher chances of autism spectrum disorder than babies born full-time, a study has suggested. They say that their findings added to the previous research that has been concluded that genetic and environmental factors can play a role in autism risk. Researchers also add that babies born in preterm still only have about 6% rate of autism, so their findings should be used as a diagnostic tool for early intervention. Autism is a common condition in our world. We have a few people dealing with that, and as shown in the research, preterm babies are higher risk. Amongst other things, a lot of things that can come with preterm. We'll probably talk about preterm birth, preterm delivery one of these days on the show, but there's a lot that comes with it, and one of them is autism, as the research has shown. Second on our menu this morning is that 816 killed as cholera spreads across 23 states in the nation. A total of 816 people have died in a cholera outbreak since the start of the year, the Nigerian Center for Disease Control says. Some 31,425 people are suspected to be infected across 22 states in the Federation, with the Federal Capital Territory, and 311 have been confirmed. Cholera dealing with us in this part of the world. In this part of the world, we talk about poor hygiene in terms of the water, in terms of food prepared, and to a large extent, it can spread. Cholera can spread, and such is the outbreak going on in a large part of the north and some part of the south and southeast. We hope that the health agencies will swing into action and make sure that we get that under control. Finally, as regards COVID, we will not get on the show without giving you COVID updates. NAFDAC said that they will begin local manufacturing of COVID-19 vaccines in 2022. So the MD, the Prof. Mojisola Adeyeye, the Director General of NAFDAC, who revealed government's planned local manufacturing of COVID-19 vaccines, also said that the agency has commenced clinical trials on 3 local herbal medicinal products. Let's hope that we are able to, come up with something and make progress. The developed nations are making progress when it comes to COVID-19. Let's hope that we can do something. We are the giant of Africa. We should be able to show that we are a giant of Africa to a large extent. So coming back to the main topic of discussion, as I said, we'll be talking about ulcers. And as I said, my guest is in the studio. I'll be introducing him shortly. The phone lines will be displayed on your screen. I know there are a few people who have badgered me that I do not open the phone lines. So the phone lines are open. You can send your messages. You can call in on the number that will be displayed on your screen as we talk about the issue on ground. I have pharmacist Israel Oni. Is a pharmacist and a very renowned health influencer. Good morning.
Good morning, sir.
How are you doing today?
Very well, thank you.
You are looking, it seems like there's a thing about you pharmacists. You always want to, I can swap so that you can sit here and I'll be on the other side. You can take over. But you're looking good.
Thank you very much.
So it's great to have you. We'll be talking about peptic ulcer disease. In the street, it's commonly known as ulcers or stomach ulcers. And people think that ulcer is a big deal. I mean, what do you have to say? What is ulcers?
Okay. First of all, let me just quickly say thank you very much for having me this morning.
Yeah.
Let me just quickly explain what ulcer is. Not really a big name as we usually think it is.
Exactly.
Ulcer just simply means sores. Ulcer means wounds, sores and wounds. So it depends on what part of the body you have it.
Yeah.
That's what will determine what kind of ulcer
Exactly.
it is we're talking about.
So you can have ulcers anywhere in your body.
It can be mouth ulcer, you can have ulcers in your mouth, you can have ulcers in the leg ulcer and all those other things. So ulcer just simply means wound or sores.
So relating it now to peptic ulcer disease, what would you say?
Okay, so for peptic ulcer disease, it has to do with the ulcer that is present around our gastrointestinal area. Like that is, okay, let me reduce the grammar.
Yes.
It's getting too much. Okay, so when you have ulcers in the stomach or the esophagus or some part of your small intestine, a combination of those three are what we call peptic ulcer disease. So if it is in the stomach, it will be termed stomach ulcer. If it is in the esophagus, it will be tagged esophageal ulcer. If it is part of the small intestine, it will be tagged duodenal ulcer. So it depends on where the ulcer is present. That's what will determine what kind of ulcer.
What differentiates, apart from location, what differentiates esophageal from stomach from duodenal? Okay,
so for the esophageal is less common. So many people don't really come down with esophageal ulcer. But for the stomach and the duodenal ulcer, one of the main differences between those two is when you have a meal, for stomach ulcer, you get that pain almost immediately after having the meal, somewhere around here, just slightly above the abdomen. But for duodenal ulcer, the pain may come in later on, maybe like 2-3 hours later after the meal has been consumed. So that's one of the clinical difference between the stomach ulcer and the duodenal ulcer.
Now, one thing we like to do on the show is dispel myths. And one of the major things we have a lot, people say not eating causes ulcer. People say when you fast, it causes ulcer. People say there are different things, there are different myths that are out there. So, I mean, I like to dispel myths. So can you clear their doubts?
Okay, so not eating doesn't really have any direct connection with ulcer. Basically, the most common causes of ulcer are, there's a bacteria that is ulcer that's also been known to cause ulcer. Exactly, that's the main thing that causes that ulcer. That's H. pylori, Helicobacter pylori, a type of bacteria that can chop off the inner lining of the stomach and then lead to the soreness or the ulceration we talked about earlier. And another common thing that causes ulcer is the abuse of painkillers that are called NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs. So once you start abusing those drugs, you misuse them, you don't use them as directed.
So basically all those drugs that people take when they say they have headache or they have any pain,
diclofenac, ibuprofen, you start swallowing. It will get to a point. What those drugs will do is that they will prevent your body from producing that lining, that covering, that protection for the stomach. And once that protection is not there, the stomach has a way of keeping producing acid for digestion of food and some other functions. So when the protective layer is no longer there because of the drugs you have abused, the acid keeps eating the walls of your stomach, and then they cause that problem we mentioned earlier, the soreness, the wound. So it's just like you pouring acid on your skin, nothing to protect you from the impact of the acid. So that's what causes ulcer for the drugs.
I mean, you've established that Helicobacter pylori is the major causative organism for ulcer. We've also dispelled that food, not eating, that's not what. But what are the things we do in this part of the world, in our community, things that the regular man does out there that can predispose?
So basically, as we've already established that, these are the things that cause ulcer, main things that cause ulcer, but there are some lifestyle we carry out in this part of the world that can also worsen our symptoms or make us very, very prone to getting ulcers. For example, smoking is a very, very important factor.
Smoking literally causes everything bad in our body.
Everything, so you need to watch that. Alcohol consumption too has also been known to worsen your symptoms.
Can you shed some light in that alcohol? Let people understand, because when we say stop alcohol, people not really understand. People don't realize that alcohol is also an acid.
Of course, it is. So the thing is, most times it's not very easy for you to just tell someone that is already addicted to just say stop this thing. Let us be factual and real. It's not easy. So you have to try to find a balance, reduce. If you can't stop completely, reduce it drastically. Like reduce it, because if you don't reduce it, it has a way of disturbing the normal function of the stomach, the way the stomach produces acid. So once this acid is getting too much in the stomach and there's no protective layer there, you will definitely have the ulcer.
And apart from smoking, alcohol, what else?
Yes, and then it has also been shown that consumption of spicy food can also worsen your symptoms. Not like it will cause ulcer, it can worsen your symptoms. So once the symptoms are not
once
there,
the sore is already there,
and then the symptoms are really,
imagine pouring pepper on it.
Exactly, pouring pepper on your sores. So it's going to worsen the symptoms. And once it starts affecting your daily activities, there's a problem. So you have to find a way out of that.
So basically, eating spicy foods, alcohol, and then we mentioned NSAIDs, the popping of painkillers, unnecessary painkillers.
Yeah, and let me quickly mention another thing, carbonated drinks. You need to watch that. All those drinks that do carbonated drinks are also known to worsen your symptoms. So you need to watch that and work on that too.
Now, having said some of the things that can worsen or predispose, what are because we have a problem in this part of the world where we do not like to seek medical care on time. We practice the God forbid medicine. We practice the anointing oil medicine and the different kind of medicine that we practice. We didn't even mention agbo. People use agbo for ulcers. A lot of things happen. So what are the symptoms that one would notice and when they notice they feel like I need medical help?
Okay, so this is where it is. I really do not like putting off the side of faith, Faith, your mind also has a role to play in whatever medical condition or disease condition you're trying to treat. But then, aside the faith part, you also have to take actions, seek medical help. Once you start noticing that this particular symptom is affecting my daily activities, I can no longer do things that I would normally do on a daily basis. For example, most times people get this pain around this side of their chest. That's just slightly above the abdomen. We call it epigastric pain. And then sometimes it radiates to the back. Yes. I'm feeling this pain here. It's going towards my back. I can't really, it's hooking me. Those are the kind of languages they use. It's hooking me. For some people, they get heartburn. While for some people, it can come with some forms of indigestion. And then there are also some alarming symptoms we also need to look at. Once you start noticing these kind of symptoms, you know that the problem is getting really, really bad. Symptoms like once you start seeing blood in your stool, or you start throwing up consistently, or you start losing weight without even understanding how the weight loss is coming about. So once you start noticing symptoms like that, we call those ones alarming symptoms. You need to seek medical attention immediately.
At times, the blood in the stool, you might not see it as frank red blood. You might see it as what we call melena.
Exactly.
Dark
tarry stool. Exactly. Okay. So once you start noticing that you're already bleeding, that's an indication that there's something going on inside. You need to work and act fast on.
So we have these symptoms. And it can obviously be diagnosed. It can be diagnosed. So what's the approach to managing a person managing such conditions?
Okay,
are there things they can do immediately to reduce the pain while they seek medical care? What's the approach? Okay,
so basically for ulcer, the treatment regimen will depend on what has caused the ulcer. Okay. So for example, if the ulcer has been caused by that bacteria I mentioned earlier, the treatment regimen will be tending towards that area, trying to eradicate the bacteria. And if it has been caused by the abuse of painkillers, like I said earlier, the treatment regimen will find a way to, take off that painkiller. If there's a better substitute, we'll look for a substitute. So those are the ways we approach treatment for ulcer. So it has to be based on what has caused the ulcer. So I didn't get the second question. What was the second question?
So, treatment for ulcer can it be treated, first and foremost?
Of course, ulcer can be treated, and you can heal completely from it.
Now, we have people who seek treatment. You are very familiar with people starting drugs, and once they feel better, they stop.
Yes.
And we know that the treatment for ulcers, triple therapy, it lasts for about 2 weeks.
Yes.
So, if I start taking this drug and I feel better, do I have to?
Okay, now that's one mistake many people make. Once they start taking a particular drug for the treatment of a particular ailment, they just feel, once I feel better, I should stop. They don't need to go for the duration they've been asked to go for. And that's where the problem comes from. Now, if you are treating that bacteria that I mentioned earlier with an antibiotics, you're supposed to take the antibiotics for the duration you have been told to do. So if it's very possible for you to feel better long before you even hit the total number of days you've been told to go for. But stopping that medication at that point can cause more problems for you. Now, it can lead to antibiotics resistance. That is, the antibiotics you're trying to use to treat that infection, the bacteria will now form like a shield it will mutate. It will get used to your antibiotics.
Nigerians have gotten used to.
Exactly. So they'll just form that shield. Yeah. Once that antibiotic is coming in another time, it won't work for them again. And we don't want that to happen because we don't have so many antibiotics to treat that particular bacteria. Yeah. So we have to be careful. So once you have been told to go for 2 weeks or whatever number of days you have been told to go for, make sure you complete that dose. Don't be tempted to stop. Make sure you complete.
And even when you complete that dose, there is maintenance.
Yes, there's also a maintenance therapy that will be given to you just to make sure that the healing process is complete. Do you understand? Because it's one thing to eradicate the bacteria, it's another thing for you to heal up completely from the impact of the bacteria in your stomach. So once you have been given that maintenance dose, you also have to take it for the number of days you have been told to take it for. So once you can do that, your ulcer will heal up completely.
Fantastic. People talk about taking milk.
Okay.
For when it comes to the hospital, I've seen a lot of patients say, "Oh, I was having the pain. When I took milk, I felt better." Okay. I mean, is that a lie? Is there a place of milk in relieving some of the symptoms? Okay, so for milk has a way of giving you a temporary relief. So when you ingest that milk, it has a way of coating that sore for a while. But don't forget, milk also has lactic acid present in it. So it's like you're still putting acid. But what you're doing is you're rubbing that acid with something soothing. Yeah. By the time that thing goes, you're left with that acid again on your sore. So that's another problem. So milk is not really something to go to when you have ulcer because it's still going to give you a rebound effect. Wow. Do you understand? So that's just the way it is for milk. Now, we've highlighted from what we've said. We don't even need to. If you go to the possible complications of not seeking medical care, especially for ulcers, it's a lot. I mean, talk about a lot that can go on.
Yes.
What can we do? What can the listener out there do to prevent peptic ulcer disease? Okay, what are the things? Maybe bullet points.
Okay. So for the, to still take me back to the causes of this ulcer.
Exactly.
Now, for the bacteria, it can be gotten from contaminated food and water. So your hygiene has a role to play here. So you have to be very careful with the way you eat out and all. Make sure, if you're eating out, make sure it is in a proper hygienic environment so as to prevent you from actually getting the bacteria. Now, the second cause I mentioned, that is the drugs part, the painkillers. You have to stop abusing or misusing drugs, even painkillers. So it's very, very important. Make sure, before you use any drug at all, make sure it is recommended or prescribed by a certified healthcare professional because they will ask some questions before they place you on any drug at all. So don't just shun off self-medication. Shun it. Don't engage in it because that's where problem actually comes from. You don't know that this drug has negative impact, so you just keep popping in the pills, and that's where the problem. So if you can take care of all these issues, most likely you won't come down with
avoiding smoking, avoiding alcohol,
avoiding all those other things.
Avoiding carbonated drinks as much as possible.
Yeah, as much as you can. Just your lifestyle modification, just modify it.
Let me just round off with this question. Someone says that I have treated peptic ulcer disease. Thank you so much for the topic. I've treated peptic ulcer disease multiple times, but it seems like I still keep on feeling the pain. Is there a problem? What can I do? Okay, so yes, it can actually come back after treating. That is why we have a role to play as individuals to avoid things that can make it come back. Now, we have been able to establish that the bacteria and the abuse of NSAID are the main causes. So if you can find a way to avoid getting that bacteria and find a way to avoid abusing the drugs, you will most likely not come down with it again. Then the lifestyle modification, smoking, drinking, carbonated drinks, watch all those things. You can't treat and then go back to your old ways. Go back to your old ways because it will make it come back. Do you understand? So if you can watch all those things, your ulcer will completely heal up. Wow, fantastic. We've been having a very, very fantastic discussion about stomach ulcer, peptic ulcer disease. Final words.
Okay, so my final words would be: remember that every drug is a potential poison. The difference between a drug and a poison is just the dose. The moment you exceed the maximum tolerable dose by your body, it ceases from being a drug, it becomes a poison instead. So do not abuse or misuse any drug at any point.
Thank you so much, Pharmacist Israel Oni. Thank you so much for blessing us with words of wisdom this morning.
Thank you.
I mean, you've heard peptic ulcer disease can be treated, but there are various ways you can avoid it, and he has clearly stated it in his conversations. It's been a very, very entertaining episode. If you have more questions for me as regards the topic we discussed today, if you want to reach out to our guests, you can always send me a message on my social media handles that will be displayed on your screen. I can definitely link you up. If you need medical help, I'll definitely link you up. You know, I don't treat on social media, so I will still have to refer you to appropriate authorities. It's still August. It's still the health awareness calendar for August, and a few things happening in August that we would highlight. As I said, before the end of this month, we're having something big coming up on the show. Remember to just stay tuned and follow us through to the end of the month. This is still the most exciting TV station, Rave TV. This is the Health Corner, and my name is Dr. George. Remember to have a lovely, lovely, and a healthy